Okay, hello everyone. We're Team 4, and we will be presenting Change the System from Within approach to our case study. My name is Hirbod Abootalebi.
I'm Leonard.
I'm Petrie.
And I'm Conor, Sexton. Before we dive into the meat of our presentation, we want to give a brief overview of what we will be discussing. First, we'll be analyzing the context that led to Amina's poor medical care. Then we'll discuss how the healthcare team could have better served Amina, even under the same constraints as in the original case. And then we'll move into our 3-year plan and its component parts that address the major issues faced by refugees, language barriers, and their socioeconomic status.
We want to acknowledge the intersectionality of issues faced by newcomers and refugees in New Brunswick. There are almost infinite symptoms of systemic racism and colonialism. The symptoms include social isolation of refugees, lack of translators in hospitals, and the list goes on. Our group wanted to address the systems that produce these symptoms as much as possible, because we want to produce solutions that are sustainable and not just a band-aid on a broken framework. Therefore, we chose to focus on the main 2 issues of language barriers and socioeconomic inequity.
We will start off with our most interesting findings in the context of language barriers. Based on our research, we have found that a large problem newcomers face is lack of access to trained translators. Sadly, due to this, they look for other forms of translation that are less professional. In the next few slides, we are going to go into detail about the language barriers faced by refugees and newcomers in New Brunswick.
In a study conducted in Switzerland regarding the language barriers and professional interpretation used in healthcare, more than 90% of the 599 healthcare workers face relevant language barriers at least once a year. 30% even said once a week.
Digging a little bit deeper into the study, we can see in the blue box that although the hospitals had national telephone interpreter services that provided interpretation in more than 50 languages 24 hours a week, it was barely utilized. However, methods that are less reliable, which have been highlighted in the red box, are often used to communicate between healthcare workers and patients. These include using body language, using a friend or family member to translate, or even the doctor contenting themselves with a poor understanding.
So what about New Brunswick? We acknowledge that not everything found abroad is transferable to the Canadian context. However, we do know in Canada, lack of access to healthcare due to language barriers is an issue. At Horizon Health, there are volunteer phone line interpreters, but they've been found to not always be available. However, in other Canadian cities, more reliable sources of interpretation are used, and we therefore know they work in the Canadian context.
We reached out to the community around us to obtain some firsthand evidence to see what's happening here in New Brunswick. Although we know these are not academic sources, we believe they are valuable because multiple people from different parts of the refugee healthcare system have resonated the same feelings. I would like to share this quote that stood out to me when I was having a conversation with a doctor here in the Dr. Chalmers Hospital. He mentioned to me that the phone services rarely get used by any of the doctors, and they usually have to rely on family members to translate. This is detrimental due to the translator lacking the quality of interpretation, which can often have clinical consequences.
Being from a socioeconomic disadvantaged demographic has very real-life implications, including increased morbidity and mortality rates. However, our team did find that the different multicultural associations in New Brunswick do provide programming to address a lot of the contributing issues directly, including English programs and transportation services. The map on the right shows all of the multicultural associations in New Brunswick. So why are some refugees and newcomers not accessing these resources? Contributing reason is when refugees and newcomers arrive in a majority white New Brunswick, they feel socially isolated and are not aware that there are cultural communities available to them. Next, we are going to discuss how we would have dealt with Amina's medical care.
As Amina's medical team, what we would have done differently is firstly, through the Carleton County Settlement Workers, ensured that she knew about the services the multicultural centers offer, such as the use of a local vehicle that offers transportation to essential services, like the hospital, to prevent the bottling of issues that resulted in her ER visit. The Multicultural Center, through the federal mandate to provide funding for child minding programs, would then take her kids to the day while she went to the hospital. This would then take care of her kids' distracting the doctor, the transportation to the hospital, and the linguistic and cultural support needed. The case with this intervention of a more integrated Horizon Health network would hopefully have these significant changes. Since her children are not present, both Amina and the doctor are less distracted. The doctor is more patient with Google Translate. Increased patience and understanding leads the doctor to search Amina's medication from her original country and realize that it causes severe liver damage. The doctor, establishing a better relationship with Amina, is considerate that she may not have internet access and suggests the public library has open computers for her to explore his recommended course of treatment.
So now to summarize our 3-year plan, we have created this simplified chart. First, discussing our language barrier-based project. In the first year, we will be getting the New Brunswick healthcare system to subscribe to Language Line and develop a healthcare professional educational program. In the second year, we will be launching the educational program, and in the third year, we will conduct a satisfaction survey on the Language Line services. In our socioeconomic inequity-based project, in the first year, we plan to develop and launch a social media and radio ad campaign in support of the bill to allow permanent residents voting. In the second year, we will film and publish a mini-series loosely based off the Humans of New York concept. We will encourage New Brunswickers to write letters to their MLAs, increasing pressure to pass the bill. In the third year, we plan to hold political knowledge workshops at the multicultural centers across New Brunswick. We will now go into more depth about what each of these steps look like.
We know from our previously discussed research that there are reliable medical translation tools. Programs such as Language Line offer 24/7 virtual translation services via video call. By subscribing to the Language Line, New Brunswick would be ensuring that they do not need to rely on volunteers for accurate health conversations.
Additionally, we found that even when accurate translation services were available to healthcare professionals, they often opted for the more dangerous forms of translation. By introducing an educational course into healthcare professionals training, it can be stressed how important it is to use the more accurate tools available to them. This training will once again help eradicate the stigmas against newcomers and refugees, especially in the healthcare field. Additionally, with any innovation, there should be a check-in to see how it is working. Therefore, an important part of our 3-year plan is to conduct a survey of healthcare professionals and patients who have been using Language Line to see their satisfaction with it.
So what is accomplished? Language Line increases the quality of the healthcare provider, decreasing readmissions through complete communication, increasing patients' trust in being serviced, and making it more likely for them to get help proactively and push for others to trust in the rising health. Educating the health professionals helps them understand their patient's background and gives them the tools to access their patient's qualitative data. The satisfaction survey in year 3 helped policymakers further progress in health studies as they pertain to how newcomers are serviced by the New Brunswick's healthcare system.
So moving on to our socioeconomic strategy, right now there's a bill being tabled in provincial legislature to allow permanent residents to vote on a municipal level. Additionally, Premier Higgs has promised an ambitious New Brunswick population goal that incorporates how pivotal newcomers are to the survival of the NB economy. Giving permanent residents the right to vote municipally will make NB a more attractive place for people to settle long-term. New Brunswick isn't the first place to contemplate such a move either. Oslo already allows non-citizen permanent residents to cast their ballot municipally. This topic has also been brought up more locally in Halifax. Now, we feel confident in this solution's ability to address the socioeconomic hardships felt by newcomers and refugees because of the following reasons. The concept of descriptive representation is that of having political representatives reflect the makeup of the general population. Having descriptive representation has been found to have the role model effect, meaning it inspires demographics that they too can run for office. Additionally, descriptive representation brings particular interest to the table. In this case, refugees' interests would be tabled by people who have experienced the difficulties.
By including a political education piece to newcomers in the 3rd year of our strategic plan, we hope to foster an interest in politics in some. By cultivating political interest in the New Brunswick newcomer demographic, individuals will feel empowered to represent their own communities. This means their unique skill sets will be leveraged to advocate for the problems that refugees face on a day-to-day basis. Refugees such as Amina, as they become established in their community, become eligible to become permanent residents. In 2019, Canada welcomed 341,000 permanent residents, 30,000 of which were resettled refugees. Newcomers represent 20% of Canada's population. This is a huge part of portion of Canadian residents who are paying taxes and contributing to their communities, but do not have their voices heard on problems that affect them, like their healthcare services.
Our plan includes a partnership with the many multicultural associations in New Brunswick to create a social media and radio advertisement campaign to support the bill. We would run our radio advertisement campaign for a month before the municipal elections happening on May 10th, 2021. This will create pressure on the people running to support this bill and make people aware of the importance of voting in this election. Additionally, our mini documentary series on refugees and newcomers will decrease stigma against them by highlighting what an integral part of the New Brunswick community they already are. Decreasing stigma will also increase support for the bill.
So how many people would be reached by our social media campaign? We found that of New Brunswickers with internet, 84% use Facebook, 33% use Instagram, 27% use Twitter, and 51% use YouTube. This is proof that our campaign will reach a lot of New Brunswickers and combat any existing ignorance there is surrounding newcomers and refugees.
So what will be accomplished by this? With the voting rights, we would be able to give permanent residents power to bring voices to their issues. Municipal candidates now also need to consider the needs of the permanent residents more than before. With the social media and the ad campaign, it would reduce the stigma and increase the awareness in New Brunswick on the problems that the newcomers face. And finally, with the political workshops, it would leverage the existing newcomer community assets and increase the community spread to even those who did not attend the workshops.
So now we wanted to move into our 3-year plan cost breakdown. Focusing on our language barriers solution, it would include a cost for each project. Language line costs around $3.95 per minute, where the average doctor appointment is 20 minutes. The cost per appointment would be around $79. There would also be a cost for providing the educational course. Running a weekend-long professional development course would cost close to $800. Contracting 40 hours of work from an expert in the issues, like a settlement worker, to prepare and present would give them a rate of $20 an hour. To distribute the satisfaction survey, a program like SurveyMonkey could be used, costing around $27. But we would also have a cost associated with analyzing the data from the survey, which would be around $160 for 5 hours of work. Focusing on the socioeconomic inequity costs, the costs are mostly focused on advertising via radio stations, posters, and developing a social media platform. The main cost would be advertising on radio stations, which we found would be around $3,000. For filming, costs would relate to producing the videos, so that would be 50 hours of work at a $20 per hour rate. And lastly, fees associated with the workshop would be paying someone to run it, and for any supplies needed for activities.
We wanted to briefly address the risks and subsequent mitigations of a recommended program. Starting with the subscription to language line, there's a chance that healthcare professionals may not use the program. To combat this, we would plan to involve the healthcare workers in the program's development, and hopefully if they're involved in the planning, healthcare professionals will be more apt to using it.
It is also possible our mandatory educational program could bring about negative attitudes from healthcare workers. We plan to address this by sharing real cases of people who were neglected due to language barriers and cultural misinterpretations. This will highlight the real-world consequences to apathy. Additionally, completing the course will count towards healthcare workers' mandatory professional development and that they need to complete annually.
A risk associated with our permanent resident voting right goal is that newcomers may not want to vote or run for office. To mitigate this, we plan to incorporate why representation is so valuable in our political workshops that are run through the Multicultural Association Centers.
With our political workshops, a risk is that there will be low attendance. A way to combat this is to get formal and informal newcomer community leaders to promote the events, as well as incorporate the event into the Multicultural Association newsletter.
Our social media and ad campaign have the associated risk of having a minimal viewership. Our solution to this is to target a younger demographic because they're most likely to see social media posts and often share them amongst their families. So now we just have our references at the end, and we have a quick summary slide if you need to get some juices flowing for questions. And we'll now open the floor up for questions.
Anytime you're ready, the judges, please feel free to jump in with questions. You have 10 minutes.
Thanks. Okay. This is Barry. I'm gonna jump in with a question. So I'm looking through. Now, I do like the approach with respect to looking at socioeconomic inequity. This is important. That phase, I would think, would be a very long-term strategy because, like the Truth and Reconciliation outlay, this all takes a huge amount of time, and it's a very sensitive topic, and it's very multifaceted. So I'm also curious, when we look at the current situation with respect to health, there's always going to be a long-term vision, but there's also going to be the I need help now. So I'm wondering, just from the perspective of this analysis, is there some short-run remedies that can be also considered here, as opposed to this, which I think is great, this long-run approach to improving the social cohesion of the environment?
Yeah, absolutely. I would love to hop on this one if that's okay with you guys. So unfortunately, it's so limited time, we had to pack a lot into a short amount of time. So with that, we really feel that there is a lot of good work being done right now, but there's just kind of a disconnect. So we tried to stress that in our short-term plan of Amina's immediate care, and how we felt that if she had a better connection with her settlement worker who had exposed her to the multicultural associations, a lot of their programming, that she would have been better served overall, because the social isolation part is such a key aspect of socioeconomic inequity if you're feeling isolated and alone in your struggles. So we feel if she was exposed to the programming that they do have already, like how to fill your taxes and English programs and etc., that she would have been better off. And that's like more of an immediate thing, that access to those programs.
Great, thank you.
I have a question, if I may. But first of all, well done, fantastic presentation. So many exciting, really well presented ideas. I could see that you had many solutions from a variety of different angles, and I was almost struggling to keep up with all the creativity and solutions that you had there. So I have so many questions for so many different parts, but obviously there's not enough time to go into all of it. But one thing I was wondering, so you talked about involvement and you went out, you talked to people and you got some feedback there, but is lack of political involvement an issue that has been voiced by refugees? Does that come from them, or is that an idea that comes from you guys?
I could answer this if you guys are okay. So we also, like, when we did some research, a lot of permanent residents in Toronto, I've noticed there's a lot of them rising up to ask for like voting rights in the municipal level, and because they're and also like in Halifax, this issue is being brought up. We haven't heard much, but when I called to the Multicultural Association of Fredericton, Sussex, I brought up this idea to them, and they loved it. They said it would help out a lot, and they would like to be involved into these ideas as well.
Okay, but it doesn't come directly from refugees. You haven't had a chance to see whether or not this idea chimes with them.
No, like we did not reach out to any of the refugees, but it was mostly to the centers. Yeah.
Do you mind if I add something, Stephen? I feel like it's useful for you. So in one of my conversations with a settlement worker at the Sussex Center, which helped motivate our idea to really look at like a long-term solution, have refugees feel like they're more part of New Brunswick as a whole, was talking about how with the settlement worker, what they see is they're refugees or newcomers. The conversations that she's had with them, oftentimes their plan is they'll come to New Brunswick because that's where they're able to get that's where they're like asked to come to. And then oftentimes when they get their permanent residencies, they go to places where they feel like either there's, for one thing, it's either there's more work, or they feel like they're more accepted and less like isolated, such as like bigger cities and Toronto and stuff like that. And obviously that's a multifaceted issue, but one thing that we could think to help combat that would be supported by Blaine Higgs with his immigration plan would be if we're giving them a voice and they feel like this place is theirs, that they would be more likely to stay. And that's something that they might not necessarily ask for, but I feel like once like it's given to them or once it's pushed for, that people who are maybe a little bit proactive would want to pursue.
Okay, thanks. I have some more questions, but I'll let others ask who haven't yet asked a question.
Can I jump in and say something?
Yes, please.
Hello. So Dr. Balcom and I have been keeping our mouths shut as we're not entirely sure what our role should be during the judging. We've been texting back and forth and thinking of our comments for the awards ceremony tomorrow about how fantastic all the groups are doing. But one thing I just wanted to say was I really admire that this group really thought outside of the box. Because as someone that works in this field from like an anthropological perspective, I just think it's really exciting when we're talking about like these seemingly intractable problems that come up over and over and over again, and we keep trying to think of solutions. So I really love the fact that you took this long-term focus and that you really thought of something kind of innovative when it comes to dealing with something that, you know, I've been having these kinds of conversations for years and years and years and years now. So I just think it's exciting to have an approach that seems sort of left of center compared to some of the other approaches, not necessarily with respect to the competition, but that I often see in the literature. I think that's really exciting. And again, every group has been doing great. We've been taking notes about the strengths that we want to highlight, but it was exciting to see something, given the interdisciplinarity of the competition, that I think really capitalized on that.
Yeah, and if I may add to that, what I really like is as well that you're using, it's pragmatic in the sense that you're trying to use solutions that are already out there that are being underutilized, right? So we're just trying to do something similar in a completely different area, which is breastfeeding in poor areas in Birmingham, where we're trying to connect women to support services that are already there, that are running, but that no one seems to think of when it comes to the issues that they face with the target behavior. So that's really good. So my one really maybe petty question, but one thing I had about the survey, satisfaction survey. Why satisfaction? Is satisfaction the best outcome for an evaluation? Is an additional question that I might have.
I can take this one if you want. But if anyone else, if you have a more thought of solution than what I'm answering now, please. So we chose like satisfaction because the biggest thing is we can offer this service to physicians and to doctors. But if they're either not satisfied with it, as in like it's not a great quality service, or they just feel like it's not useful within like the specific context, you know, because they would be the experts. That would probably be the easiest way for us is just go and, you know, survey all the doctors, all the physicians in the department, and ask them whether or not like the service that you're providing, A, do you use it, and B, are you satisfied with it? And I think like from we didn't really think about like too explicitly about what the survey would entail, but I acknowledge that like there would also be you know, maybe some other metrics that we'd include as well. And so satisfaction was maybe like envelope term, but specifically we're thinking about asking the physicians who like, or we want them to use the service, and if they're not using it, well then, or they're not satisfied with it, then that's a problem.
Yeah, if I could add on to that as well, Conor, like I think you were definitely hitting the nail on the head, but also just how it's already been shown that if you're not satisfied with it, you're just not going to use it. And with any system, like you can have like a really good system outline, but when people go in there and interact with it, if they're not satisfied with it, they're not going to use it. So I think on the health physician side of it, that's the really key part, is that if they're satisfied, then they're good. It's like, it's pragmatic in its use and everything, and it's helpful. But also on the patient side of things, like I feel like a sense of like safety and like mental health is a big part of any treatment as well. So if they are feeling satisfied with, like, they feel they're being heard, once again, I feel like satisfaction is just a good way of measuring that.
Awesome. Thank you so much, everyone. That was perfect timing. We just have just tiny bit of time left. Any last minute questions, anyone? I'm taking that as an, oh, sorry.
I would just point out too, with the satisfaction survey, some open-ended questions getting direct feedback as to, you know, what else could be done, I think would fit really well with the storyline that you guys have presented here as a way to improve in the long run sense of things, especially when addressing the systemic inequality or inequity that exists. So giving them a voice, not just, you know, a lot of times with surveys, and I'm a quantitative analyst, so I tend to look at things from that perspective of we deliver the questions, you respond within the domain that we provide. But I also see a benefit in these qualitative responses that can provide they can provide a direct response back.
Hi, it's Victoria. I just want to just quickly jump in. I just thought you guys did a great job with your presentation. I think you guys are looking at the bigger picture because, like you said, there's solutions, but there's no quick fix, like an overnight quick fix. Taking the time, and also, like, I thought, like the concept of having the refugees feeling welcome and able to vote or feeling part of something, like they belong to the community. I thought that was really good. And it's true too about when you're saying that they have things in place in the system for translating, things like that. If people try it and it doesn't work well, you're right. They don't want to use it, because sometimes we've reached out and you're not able to get a hold of anybody to translate for someone. So, you know, you're a little leery. You would rely more on the family member that's present so they can talk to their family and you can give them the information. So I thought I know it's a 3-year plan and things take time, but I really thought it was a good plan that you guys came up with.
Awesome. Thank you so much, Victoria, and other judges. So that we came to an end of this presentation. Thank you so much, Team Full. That was amazing. So judges, please go back to gather, and the next team up is Team 5. So the Zoom link will be posted on Team 5 room. Thank you. Have a good day, everyone.
Thank you.
Thanks,
Well
everyone. Great work.
Great.
Yeah,
Awesome.
excellent
Thank you,
job.
guys.
Excellent job. You should be proud of yourselves.
Thank you.